Good afternoon, everybody, and welcome to Grand Rounds today. Today, it will be my pleasure to introduce actually three speakers. Andrew Allen, who is the president and CEO of YSS, and Andrea Dickerson, who is the VP of Programs, and Matthew Voorhes, who is the Residential Program Director. They have very, very kindly accepted our invitation today to provide us with an overview of YSS services offered and how to access those services. And please join me in welcoming Andrew, Andrea, and Matthew. Thanks.
All right, I've got a mic. Can you hear me? All right, you guys, like I said earlier, are you ready for audience participation? You guys ready to do this? Really grateful for the opportunity to come and talk to you a little bit about YSS, and we've titled this Cultivating Resiliency, and excited about some of the projects that YSS has going on to grow our behavioral health services. And very, very grateful to my colleagues, Matthew Voorhes and Andrea Dickerson, who are really the driving force behind a lot of the programs that we're running and going to talk to you about today. Our mission at YSS, and down in the bottom left-hand corner, you can kind of see our one-page card that talks about who and what we are, is to create hope and opportunity. And we do that through our core values of commitment, collaboration, compassion, innovation, integrity, and a can-do spirit. And we've got this vision, so like where we're going, and it's a world where youth are valued and empowered to stand strong. So that's why we do what we do. Every day we're getting out of bed to create hope and opportunity. So here's the first chance for audience participation. Why do you guys do what you do? What's the purpose? Why do you come to work every day? Go ahead.
Take care of the patient the best that we can.
Take care of patients, I like it.
Make a difference.
To make a difference. We got some students, is that right? Why are you guys pursuing the medical profession?
Just to help people.
To help people. Anybody using Chat GPT, artificial intelligence? I asked it, hey, tell me, why do physicians exist? Why does the medical profession exist? It gave me three things. You tell me what you think. Number one, alleviate suffering. Number two, heal the sick. Number three, improve quality of life. So that feels like what I heard, why you're doing what you're doing. And as I looked at that, I sense we have a shared mission. And we're working towards similar goals. So I'm grateful for the partnerships that we've had with Mary Greeley and McFarland Clinic over the years, and really excited to talk about some of the things that we're doing here today. And I did want to just interject some personal stories, anecdotes about doctors, physicians that have had an impact on my life. And I thought I would start with, we just came from a Thanksgiving Day potluck. Grateful to have the opportunity to, commune with my colleagues, and everybody brings something. I don't know if you've got a specialty that you bring, but every year I bring the same thing. It's the dessert, the main dish, and the appetizer. Anybody want to guess the one food item that I bring? Bacon, right? In a state where pigs outnumber humans 7-1, where we've got an abundance of bacon. We've got Bacon Fest. I mean, I love bacon. I just love bacon. I did keto for a few years, and I just ate as much bacon as I could. And then one day, I was at the grocery store in Fairway. I'm a Huxleyite, and as is Matthew. And in the corner of the cabinet where they sell the bacon was this brand new, glorious package, 5 pounds from Webster City Custom Meats, 5 pounds thick cut bacon, $19.99, $4 a pound. You're familiar with it? I've got some head nods. It was so good. It's like it was a lost leader. They just wanted to get people hooked on it. I'd been buying it, and I wanted to share it with the group of colleagues, of people that were shopping at Fairway. And so I started going around telling them, hey, great deal, aisle 3, 5 pounds of bacon, $19.99. It's $4 a pound. And I told 2 or 3 people, and then I got to another person that I recognized, Dr. Selden Spencer. I'm like, Selden, bacon, it's on sale, it's a great deal. And he's like, if you know Dr. Selden Spencer, he's extremely polite, really reserved, and he essentially said, wow, that's great, Andrew, I don't eat bacon. And I'm like, you don't eat Bacon? Like it's the greatest thing in the history of food. Why don't you eat bacon? He's like, oh, I'm trying to, eat healthy. And we walked away from each other, and it just kept playing in my head. Like, here's this guy that, his job is to alleviate suffering, heal the sick, improve quality of life. And my favorite food, he doesn't even touch. And do you want to know, that was a year ago. You want to know how much bacon I've eaten prior to that conversation, post-conversation? Less than 10%. I mean, I haven't eliminated it completely, but I used to feast on bacon. And that one conversation with a trusted provider in a grocery store, changed probably the course of my life to a certain extent. So I just don't want to, I want you to understand, and I know that you do, I'm preaching to the choir, the impact that you can have on people's lives, whether it's in a grocery store, right, in a surgical center, a hospital setting. You'll have the chance to impact lots of people and transform the way that they think about life and quality of life and alleviating suffering and healing the sick. So I thought I would start with that. Let's see, I'm going to advance the slides, and then we'll get right on. Who knows anything about YSS? Anybody? What do you know about YSS? Anybody? What?
Help kids.
Okay, we help kids, great. Anybody else? Mental health, fantastic. Daycare, yep. We've got before and after school care, summer care, you got it. More than 40 programs, more than 330 employees across half a dozen locations, helping 10,000 kids and families a year in lots of different ways. And so you can see our history. I won't spend a ton of time, but be proud that Mary Gree, the Medical Center, McFarland Clinic, headquartered right here in Ames, Iowa. This is where our roots are. Ames, Iowa. This is where we're headquartered, where the majority of our employees are. And I feel like Story County really benefits from many great youth-serving nonprofit organizations like YSS, but we've got plentiful services right here locally. And we started and we've grown over time. We've expanded to different locations, not because we saw them as target markets, but because people invited us. Hey, you know what you're doing in Ames, we really need that in Marshall County. So we went to Marshall County. Hey, what you're doing in Ames, we really need that in North Iowa. We really need that in Des Moines. And so we have had the chance to grow into different areas and grow both our impact and our focus. Here are the locations. So really like this new map. Kara Warmy is our Chief Development Officer. And she just put out, so some of you might have picked up a impact report. She's like, you got to be conservative in handing those out because they're like, I forget how much they cost necessarily. But we've got one-pagers here, so if you're interested in learning more about YSS, definitely pick up one of those impact reports. But otherwise, we've got a one-pager that's going to outline much of what we're talking about today. We are headquartered in the old Ames Municipal Building, just north of downtown Des Moines. It's a beautiful building. We've got a picture of it there, and we've got other locations across central and north Iowa. We've got 3 statewide contact tracks that allow us to take care of kids across the state. What we do, education, stability, and counseling. So again, 40 programs, it's kind of a complex story, but the way that I describe it most often is we had our roots in child welfare, emergency services. Our founder, George Belitzos, he saw kids on the streets, not connected, like no place to go, runaway and homeless youth. And he created a bus stop where they came and they hung out over the weekend, and the weekend would get over and they'd realize they didn't have a place to go home. And so in the early 1970s, he created shelter for runaway and homeless youth. 40 years after we had an animal shelter, Iowa finally had a shelter for youth. And he really pioneered child welfare and emergency services across the state. And so what we realized is a lot of these kids had mental health needs, addiction, substance use disorder. So we started doing treatment to address those. And you can't work on the problem long before you say, gosh, is there something we could have done to prevent this? And we have a whole host of programs, the before and after school programs, the mentoring programs. We're going into schools and teaching kids about being too good for drugs and, suicide prevention. So We spend a lot of our resources there. And one of the few organizations that has the ability to work with kids past their 18th birthday that are focused on youth. And we've got some contracts that allow us, your frontal lobe's, still developing, especially for guys into the mid-20s. I mean, even females as well. So we help provide stability from a housing standpoint and to help youth transition out of the foster care system. So this is why I care. I just threw this up real quick. This is 1995. This was my admission photo. So President and CEO is my title, but my most important title is alumnus. So I went through the program at YSS, saved my life. I had an interaction with another doctor. I've got three that I'll mention, the second of which is Dr. Skolton. So he was a psychiatrist across the street. And my family was very worried. I'd been arrested for felonies when I was 10, expelled from school, bad into drugs and alcohol. And we had a consult, and I spent what I would have described at the time as 9 of the worst days of my life on, I think it was the 3rd or the 4th floor. It wasn't the 6th floor for kids, in the psychiatric floor for kids. And what happened was it started the process to get me help, to ultimately get me to YSS, where I received life-saving treatment, and am extremely proud today to be someone in long-term recovery and now leading the organization that saved my life. Just a couple stats, and then we'll turn things over to Andrea. Iowa ranks 48th in the country for the availability of behavioral health beds. We're going to talk about what our solution is there. 7,000 youth in Iowa need substance use disorder treatment every year and don't get it. 1 in 6 of us, I'll claim it, will have a substance use disorder over the course of a lifetime. And then think about this, 90% of those that become addicted start before their 18th birthday. If you think about what's happening right now as it relates to like the proliferation of marijuana, even medical marijuana, the perception of risk is decreasing. And so many kids that get exposed before 18 have an increased likelihood of becoming addicted. And there's 9,000 youth every year that experience abuse or neglect. We are in the midst of a children's behavioral health crisis. Iowa was sued with a class action lawsuit. 36% of Iowa's youth have felt sad or hopeless, could be clinically diagnosed with depression. 27% of high school youth, 1 in 4, have considered suicide. And then when you take it a step further, of those that had considered it, the percentage that had a plan was like 37%. And the ones that had attempted it comes out to ultimately 1 in 20 of our middle school and high school youth in Iowa. 1 in 20, guys. Every single classroom in the state over the last 12 months, one of those children have tried to take their life over the course of the last year. So we've got a crisis.
Thank you, Andrew. Are you able to hear me? Okay. So what Andrew was just explaining is stuff that we're seeing every day, and depending on what type of medicine you're either in or going into, you're probably either working with kids or working with adults that are worried about kids, whether that's a parent or a grandparent. And so it is real. The mental health crisis is real, and we're just seeing more and more kids coming into our services and young adults as well. So just to kind of start off, we have our clinic here in Ames. It's the Family Life Center, and it's the clinic within it. So if you're coming up here to work and you're there on Duff and you happen to be parked at the light by Panera or Target, if you look up to the left, you will see a building with the YSS on the side. It's 125 South 3rd, and that is our clinic here in Ames. We have very similar clinics in our other locations. So close, hereby would be the one over in Boone, which is right by the Boone Hospital. And what I'm going to then talk about today are some of the services that we are providing in all of our locations. And so the first one would be our psych med management program. We're fortunate to have several prescribers, ARNPs, as well as a child psychiatrist, that we have hours throughout the week where individuals can come and receive psychiatric and med management services. Some of our folks are in person. Others, we connect the client to somebody that is virtual. And we are right now could place somebody that isn't a super complicated case, if that really exists. We could do that within about a week or two. Something that's a little bit more complex, meaning major medical history, maybe a long history of different medications. That's going to take maybe a couple weeks to get them in, just because we want to make sure that we get them with the right prescriber, the right medical professional that can really specialize with whatever it is that we think's going on. And for this program, and overall at YSS, our medical director is Dr. Steering, so you might know her. And we meet with Dr. Steering at a minimum quarterly, but we consult with her throughout the time. She's able to answer questions, and she also oversees any of our medical procedures and processes. She also then oversees our prescribers and makes sure that does kind of like quality assurance quarterly. So we're very fortunate once again for that partnership. Let's see. Whoops. What was I supposed to do? Okay. So along with psych med management, we also have addiction counseling. This is something that YSS has provided in Ames and our other communities for several years. And it's not just for adolescents, also young adults and adults. But as is common with the addiction field, marijuana and alcohol are still really the two biggies. They're the most common in any of our outpatient and residential programs. It is really marijuana and alcohol that are the most used. And what we know is that when a young person starts using it, their brain development then gets impacted. Memory loss, difficulties with paying attention, focusing, and really it can become a barrier for them to be able to learn and to be successful in school. So it is an uphill battle because marijuana use, that perceived risk that Andrew just mentioned, it is becoming more and more common that people just don't think it's a big deal. And it's really hard for a kid to think it's a big deal if mom and dad are also recreationally using marijuana. And so that is something we are striving to within our prevention programs and our treatment programs, is to get the word out that it is not a good thing for a kid. It can really create damage for a young person to be consuming marijuana. The other is alcohol. We saw alcohol rates just skyrocket during the pandemic, really for all ages. But binge drinking, as you can see, is something that is very popular in Iowa. And when I say binge drinking, that's for like females 4 drinks, males 5 drinks in one sitting. So over the course of 2 weeks, if one time of having 4 to 5 alcoholic drinks is considered then binge drinking. And binge drinking can really then start to do damage on the brain development as well. Opioid use, and that's a major crisis that we have that you, I'm sure, are familiar with. Fentanyl use is something, as well as other opioids, is something that we're seeing more and more young people experimenting with, not really realizing what they're using. And in our residential programs, I would say at least half of the youth are reporting some sort of opioid use, and some going as far as saying that that's their drug of choice. So it is definitely becoming more and more available, which is extremely scary given the overdose rates. One of the things that we do provide within our addiction programs is multidimensional family therapy. It is an evidence-based, effective model to not just work with that individual, that youth. As much as parents sometimes think, let me bring my kid and you're going to fix them, this is actually a systems approach. And so we're going to work with the whole family. And sometimes that could mean you sit down and you're meeting with the parents as parents, maybe them as a couple or co-parenting, even if they're not still in together in a relationship, they're still forever co-parenting. And how do we help this family develop that closeness, that emotional connection once again? Because what we find is when there's some sort of a severed relationship, just a loss of connection between an adolescent and their parents, they turn to high-risk behaviors. And as an adolescent, high-risk behaviors often will involve substances. And so multidimensional family therapy is something that we will do with our teenagers that come into our outpatient programs as well as in our residential programs. And a very effective way to really help the whole system function in a better way. We can take referrals for our substance abuse programs really at any time. So if you were to call today on a Wednesday, maybe not, tomorrow or Friday, but by Monday, we'd be able to get you scheduled. And so if you or you knew somebody or you wanted to help make a referral for a patient, we would be able to get them seen quickly.
Oh, I just hit the arrow.
I don't. Okay. Then I went too far that time. Okay. The mental health therapy is one of the other main services that we have in all of our clinics. And so here you'll see some pictures of our therapists. There are 4 of them. We have others, but it is really important for us to have wraparound services. And so when an individual comes into our services, into our clinics, we're going to assess them and see what really, what's going on. Is it solely mental health? Is it solely substance use? Usually it's not. Usually it's a combination of the two, or there's something complex going on. And so we have different therapists that specialize in different modalities and working with different populations. Some of our therapists really work with the young ones. They might do play therapy and use play within their sessions, especially with a young person that maybe doesn't have the words to be able to communicate how they're feeling. Some of our other therapists work a little bit more with like an adolescent, young adult, or even adults. Some of our evidence-based models are the EMDR, so that's the eye movement desensitization therapy, and that can be really effective for somebody with significant trauma. The STEPS program is out of the University of Iowa, and it is also for the individual with extreme emotions. That person who has really, really high highs and low lows and really can't imagine they can't manage them, and it kind of seems all over the place with their extreme emotions. STEPS can be a really effective approach to work with them on that. So just a couple notes. We have several therapists at Ames as well as our other locations. Leslie, who's on the left top, she's actually at our Roland Story School. And so Roland Story School District, the last couple years, that superintendent and I worked out an agreement to be able to have a full-time therapist at the schools. And so she splits her time between the elementary, middle, and high school throughout the week. She's at certain schools, certain days, and is full. She's busy seeing students, and the school and the parents and community really appreciate it because that takes out the whole travel barrier. That even though Roland and Story City aren't that far from Ames, it can be a major barrier for some families. And so by being able to see the kid in the school can just really be convenient. Others, Jenna on the bottom left, she spends some of her time in the Ames schools. And all of my therapists out of our Boone office also spend half a day, if not more, throughout the week in pretty much every school in the Boone County. So we love our partnerships with the schools because we know that can be a really nice way to be able to meet a need that the school and the community has. Andrew? Oh, my bad. One more. Integrated health. So those services that I just talked about are all ones that insurance, somebody's primary insurance, healthcare can cover, Medicaid can cover. We accept all of it. But integrated health is this Medicaid-driven or kind of created program in Iowa several years ago, and we specialize with working with the pediatric population. But integrated health is really a way to provide care coordination and support. We're removing barriers, we're increasing access. We work with the whole family, even though the youth is that identified patient, and there's some criteria, not too stringent criteria for somebody to be able to qualify. But it's really an opportunity then for those care coordinators on that team, which includes an RN, to really figure out what does this family need? How do we need to support them? And oftentimes that means they're working with our prescribers, our therapists, our counselors, the school, juvenile court or DHS, all the players for each of those families. And they help really coordinate and make sure that everyone's on the same page. Because otherwise, sometimes there's a lot of complexity for some of our cases, and not everyone knows what's going on and what others are doing. So the care coordination is a really great way to kind of streamline that.
I know the hospital is accredited. I know you've gotten quite a few national awards. YSS is also accredited by CARF, an international accrediting agency. Andrea leads that effort across our organization. They come every 3 years, and I think it's they fly 2 or 3 people on site for a week, and they look at our books and visit the programs, and then Andrea also has an opportunity to go out and survey other organizations across the country as well. So we're grateful for that. I love innovation. I mentioned it was one of our core values. I thought I'd just mention a couple projects before we dig into the big one that we really wanted to expose to you today. If you are downtown Des Moines, or if you go downtown to Des Moines, you go to Des Moines, 235 kind of cuts through the north side of downtown. 6th Avenue, if you go north, you'll see Mercy Hospital kind of on your right, and there'll be a McDonald's kind of on your left. Just beyond that is this beautiful building in the upper left-hand corner called 6th Avenue Flats. It was one of the first projects in the country to marry education. So we partnered with DMAC, low-income housing tax credits. We partnered with a developer and a youth serving organization that houses homeless kids in a beautiful building just north of downtown. And we've got 5 dedicated apartment units out of this 42 apartment complex. And the last I heard, we had 9 going to 11 of our youth are living in this space, really getting great safe space and therapy services and other wraparound services from YSS. Bottom left-hand corner, rooftop gardens if you head down to Des Moines. And Euclid Avenue, East Euclid, if you go west, you got the Restore for Habitat for Humanity. If you go east, you'll have Hy-Vee on your left and like Walgreens on your right. Just beyond that is this building where I feel like it's going to be one of Iowa's most innovative workforce development programs. In Des Moines, we're really focused on transition age, young adults, homeless youth. And so we have 6 retrofitted shipping containers. This guy right here is a shipping container that has vertical gardens in it where we will grow leafy greens hydroponically. And we got another grant recently to add 4 more gardens, so 6 gardens. They represent 2 to 3 acres of land apiece. And we can grow leafy greens 24/7, 365. We were in Hy-Vee's corporate office earlier this week, scratching out what the partnership might look like, and really cool innovation there. That said, we've been talking about behavioral health, right? And addiction and substance use. And YSS has been doing this for over 40 years. I am an alum of the program, saved my life, and I got treatment up there in the upper right-hand corner. Anybody recognize that house? It's a Bud Mansion, 8th and Kellogg, just south of here. We've got 10 boys there right now who are getting substance use disorder treatment from across the state. Just below that, anybody recognize that building? Well, that is owned by Mary Greeley. So when I mentioned some of the partnerships, you might know there's 2 houses on campus close to your campus. One actually has like a youth shelter or YSS sign in front where we house homeless youth through our transitional living program. And then this one, which is just outside the medical arts building just to the west, we had a fire in a building a few years ago, and Brian is somebody I look up to, and Andrew as well, mentors in the healthcare field. Gary Botine, your CFO, was my boss for a while, so he was on our board. Christy Krause, who led your behavioral health and retired recently, she's also on our board, so many connections. Gary was able to help us secure this space. So we've got home-like environments to provide substance use disorder treatment to our youth, and I think the lease, I probably owe him whatever the lease. It's a really great rate they're giving us, but sometimes when I say Brian, I'm like, oh man, I owe you that dollar that you're leasing the space. So old buildings, home-like, which is great, but just not up to the needs that we've got today as it relates to the acuity of the kids that we're seeing. So we've got this slide that essentially says we can do better. What if we were to envision like a best-in-class space? What would it look like and where would it be set? We have been working on this idea for 5 or 6 years, a best-in-class space where we can provide addiction treatment to youth across Iowa, nature-based, trauma-informed, experiential, and I think that we've got a video, less than 2 minutes, just to kind of introduce the concept. Look at this, impressive, well done.
For more than 45 years, YSS has been creating hope and opportunity, operating programs from old houses in a residential neighborhood. But given the increased need across the state, it's no longer the right tool for the job. More than 7,000 kids need treatment every year in Iowa and don't get it. Now there's hope. We're working on a campus project to combine crisis stabilization, emergency shelter, and substance use disorder treatment for adolescents and transition age youth, serving the entire state in a centrally located campus, nature-based, on more than 50 acres between Ames and Des Moines. We're creating a best-in-class program alongside best-in-class facilities on a best-in-class site.
Ember Youth Recovery Campus. Ember represents hope, a small glowing fragment of fire that when nurtured and cared for, creates a fire for life in the hearts of those that will be served.
The thing that gets me the most excited about the new campus is going to be allowing the kids to be out in nature, to be able to really ground themselves, be able to see the trees, see the wind move through the trees, be able to feel the grass in their hands.
The road to recovery starts here.
So there's the site, 53 acres of prairie and timber located just south of Ames, a Cambridge, Iowa address. What do you think? What do you think of that space? Getting kids out of the cacophony of town. I think the girls, I go to the house, Kara was just there yesterday. They're like sometimes, they've got the windows closed because people are walking by. Sometimes they like to see the people walking by, like, oh, hey, they know. But some of you probably walking by as you're coming to work in the morning. But to get them set apart from, so many kids are on their devices, so much focus on social media and all the things, and many kids are suffering from nature deficit disorder. I don't know if that's clinical or not, but we got a book that talked about Last Child in the Woods, and this guy coined a phrase, nature deficit disorder. So that is a 53-acre parcel of property that almost 3 years ago, on a cold December day, after taking a phone call from Dr. Jay Brown and sharing this vision, he said, gosh, he's like, tell me more. I said, nature-based treatment. He's like, tell me more. And I told him, he's like, Andrew, I've got this property. I don't know what I'm going to do with it. And I was, oh, great, let's talk in a couple of months. It was December. And he texted me back 20 minutes later and he said, I've talked to my wife, I've talked to my kids, I'll meet you out there tomorrow. And he brought the deed with him. And we walked this site through the snow, and we talked about what it might look like to provide transformative, life-saving, holistic, nature-based, trauma-informed addiction treatment to kids across Iowa. And he gifted us this property and really helped us launch what had been this vision to create Ember. So these are actual renderings, like this building's actually going up. I think this has got like a metal roof, and we had to cut that from a pricing standpoint. But this is happening. We're 14 months into the construction. These are the cabins. There's 3 cabins. This will be 70 beds, providing, like I said, best-in-class substance use disorder treatment. We wanted it to still look like home, so, not overwhelming, but these are fairly big cabins to meet our needs. Here's the back of it. When we presented this to the board, I had a board member came to me afterwards and he said, just so proud and excited. And, we've been just getting by for so long, providing really high quality services that Matthew is about to tell you about, but doing it out of old homes. And so now to finally have a space that is commensurate with the quality of the programs and the staff that we have, the board member came to my office, he says, Andrew, that's where I take my family for vacation. And so I'm just so proud of the project, for the team that's helping to put it together. And the guy that's helping to lead quite a bit of it, Matthew Voorhes, been with us for 6 years. Andrea's been with us 26 years. She didn't quite provide treatment to me, but almost. And so we're just grateful to have the opportunity to give people their, a chance to do their life's best work, and super grateful to have Matthew in a leadership role.
Thank you, Andrew. Everybody hear me okay? I might have to lean down. I don't know if I can bend it up.
Yeah, you're fine.
My name is Matthew Voorhes, and like Andrew, I went through treatment myself 23 years ago. I went through a different program, but a lot of people really had a huge impact in my life and changed my life. And so I've been working in residential treatment now for those last 23 years, and really been an honor to do that. But yeah, Ember Recovery, we are pretty excited about it. Our residential treatment program is a level 3.5 substance use program. So as you think about maybe some of your options, some of your child welfare options that are out in the community, you maybe hear terms like group care, what is now called QRTP. I don't know if you've heard that term. You may have heard PMIC, Psychiatric Medical Institute for Children. Those are levels that are a little bit higher than us. So we are level 3.5 substance use. So we will sometimes get kids who have gone through those, and we'll be working on those primarily substances when they come to us. Or if they're really struggling with us, they might end up going to one of those facilities for different reasons. But yeah, we serve adolescents ages 13 to 17, both boys and girls. We do gender-specific care. So a lot of our treatment, our groups, we have specified groups for both boys and for girls to work through those things. But new at Ember Recovery Campus, part of those 70 beds is going to be for young adults. So we are going to be opening up 20 beds for young adults ages 18 to 24. Our girls program will also be expanding out there, so we'll have 20 adolescent beds and 20 young adult beds. And so, right now, there's not a lot of options for substance use care in the state of Iowa. We are one of 3, I believe. For us, Jackson and Stars are your 3 main places. And they also have a small amount of beds, and so there's just not a lot of space. And so we're very glad to have this opportunity to increase this space. So it is a 90 to 120-day program. So those 2 houses that he showed you, our clients currently live there. They live there 24/7, 7 days a week. And they do that for 90 to 120 days. Sometimes our clients will stay a bit longer, but that's the typical length of stay. We also take almost any kind of insurance, commercial, Medicaid, and there are some grants available for certain other cases. Like sometimes we'll see a Hawkeye client that we would have some money available for that as well. But very rarely do we ever have to, I don't think we've ever turned down someone because of financial reasons. So we're very open in figuring that out with the family. It is a phase system based on a clinical treatment plan. And so we focus on the trauma and the why behind the behavior. Each phase, they kind of progress through and they can earn privileges, like any kind of program like that, eventually going on passes, getting back into their home. So the family engagement's really important for us. And so they start off with a smaller pass, but then increase that as they go, getting back home more and more often to spend time with their family and test what they're learning, in a sense, when they're in treatment with us. So again, group and individual therapy, we do both. We do substance use counseling and we do skill development. And that's through group and also the practice that they get in the milieu each day with their partner clients. But the enhanced family engagement, Andrea mentioned MDFT, the multidimensional family therapy, but we've also started a program called Strengthening Families. That is an evidence-based program that we use, and we do that once a quarter where we engage the entire family. We bring them for the weekend. We pay for hotels if they need help. We pay for gas if they need help. And they spend the weekend with us, with their kids, going through just really practical steps, really practical things for their home. And some of these parents have tried these things before, because they're not like mind-shattering concepts that we teach, but there are a lot of basic concepts that parents have maybe tried before, and there's been no partnership with the child, or they haven't tried them at all. And so we really spend time building together with the family and going through each of those steps to get partnership from both the client and from the parents, so they're all together on the same page, coming up with ways to bond, ways to, what are consequences going to be? What are our rules? So we come up with those together. So in the heat of the moment, when things happen, we don't end up changing things and, going to the extreme or making things up when we're really upset with something that's happening in the situation. Admissions criteria. Our primary, the main diagnosis has to be substance use. And it has to be from a recent qualified evaluation from a professional. And so they have to have some sort of substance use diagnosis. But we also have a lot of co-occurring mental health diagnoses.
How many people see kids or youth? So some of you will, or at least you'll know some people that do. This is an interesting one, and sorry to interrupt, Matthew, but just thinking about 7,000 kids that need treatment and don't get it. There's only 3 of us providers, and while we do have somewhat of a waiting list right now, there are times that we don't. And I think that some of that has to do with the corresponding, co-occurring mental health diagnosis that always comes alongside a substance use diagnosis. So there's not a kid that we admit that's not going to have a mental health need. They all do. Yet for insurance to pay for substance use disorder treatment, they've got to have a presenting, what's the word? Well, you said it.
Substance use diagnosis.
Yeah. Oh, a primary diagnosis, substance use. So just be aware of that as you're kind of pursuing your medical professions, as you're talking to folks. That I think sometimes that keeps kids who could benefit from treatment out of our program, because it looks like a mental health need with, they're simply just, self-medicating with substances. And maybe it's something that, Kara helps us with public policy that we can continue to advocate for, because the substance use disorder treatment is so critically important, and it includes all the mental health stuff that you need. Yet we do sometimes have parents say, well, their kid didn't have a primary substance use diagnosis, which keeps them from coming, or at least keeps insurance from paying for it.
And so we get referrals from parents, probably at any given time. 50% of our population is parent referrals, and they've heard about us from somewhere. We would like to, more primary care physicians having knowledge about YSS so they can talk to families when they come in and for any kind of visit, and maybe that physician has heard or is hearing something about substance use, could mention us as well. But court orders, the other half of our population usually is a court order through juvenile courts. We will work with HHS, which used to be DHS, so Health and Human Services, and even substance use committals. So we're not a locked facility, and even out at Ember, it's not a locked facility. It's locked from the outside, so people can't just come in, but clients can leave and they can walk out. Because of that, we want, I always say 10 to 15% desire to change, right? So as soon as they get dropped off, they're not just out the door. We want a little bit of a desire to change. And so we talk a lot in admissions. We talk with the family, we talk with the client. We make sure they know what they're getting into, what they're committing to, so that they're ready to address those needs when they come. But yeah, parents, court orders, committals. We see a lot of referrals also from mental health outpatient facilities across the state, and also a lot from hospitals. So we partner with several hospitals across the state who oftentimes will send us referrals from the adolescent beds that they have. And so we get a lot of those as well. We don't deny a lot of people, but on occasion, There is some increased risk that because of our setting would not be safe for them or the other clients, or even for the community surrounding us. So if the client has an enhanced elopement risk, so they run away a lot, and that's just what they do, probably not going to be something that works out the best until they're ready to plant their feet a little bit more. Sexual assault history. So if they're the aggressor, and that's been happening quite a bit, that's something also that we'll evaluate as a clinical team. It's not an automatic no all the time, but it's something that we will definitely evaluate and see if it's safe for our current milieu. Complex medical history is also something that we evaluate on a case-by-case basis. We've had lots of kind of complex medical cases throughout the years that we've worked with, but we want to make sure that we can provide the kind of care and make sure that they are connected with their physicians enough to have the help that they need. And then also enhanced mental health. And those would be cases that would typically qualify for a PMIC level of care or higher. You might be talking about some severe RAD cases or severe, attachment cases, things, or just other significant, like high suicide risk. We definitely work with clients who, go through suicide risks for sure. But if it's a really high level, then something that we'll evaluate and maybe make a referral to another location. So, excuse me. But yeah, any referrals that we do get, if they are not a fit for us, I know our admissions office, our clinical team, we do a good job of referring out to other places and educating people who call us, because sometimes those, if you call us, you might not know all the options that are available around the state or even in this area. So we will do a good job of making sure that you get the information you need when you call us. Okay.
Well, and before I start talking about crisis stabilization, one of the things when Matthew just spoke about elopement risks, if you think about where our current facilities are located, our boys' house, Fairway is like a block and a half away. There are gas stations within a couple blocks. These kids, if they have that knee-jerk reaction to leave, have a lot of places that they can go and then get access to different items that would not be good for them to get their hands on. We are really hopeful that at the new campus, so they elope from the facility and they walk away, but they still remain on our property. And so that individual who might have this really like this reaction and they just run, and that's just how they handle stuff, we will help them be able to do that within the confines of the entire campus and our property. And that will then help them. Our goal is to then learn additional skills. So then the next time they start to get upset, they don't feel like just running. And so we're hoping that the elopement risk will look different on campus. One of the other programs that is going out to campus is our crisis stabilization program. And so currently, crisis stabilization is located in our two shelters, the one here in Ames, Rosedale, as well as the one up in our Mason City location. And so the crisis stabilization program was created a few years ago when the Children's Behavioral Health System was created here in Iowa. And it was really designed to be a short, brief intervention for an individual who is in a crisis. And so a kid within that 12 to 17 age range, because it's in our shelter, they need some sort of an out-of-home placement for a couple days in order to get everything reset. They can come to our crisis stabilization program. They can come at any time of the day or night, 7 days a week. We have round-the-clock care. Within that first 24 hours, they will meet with one of our licensed therapists that will do an assessment and figure out kind of what's going on and make recommendations for them and their family. And then every day that they're in that program, which can be up to a couple weeks, 14 days, is individual therapy or family therapy, as well as group and skill group type programming. So they're getting a lot of kind of intense services to be able to maybe learn some skills, coping skills, self-care, work with their family to get everything reset, and then figure out what are the resources that they can access. So when the kid does transition home after a few days, then it looks a little different. And then we have a transition plan that will help support the whole family. So, we think about it, it is common, kids do struggle. They go through some sort of a mental health concern or crisis from time to time. And if we can identify it, get it have a brief intervention and stop it from worsening, then you're going to prevent that individual from having, that much more of a significant mental health crisis. Whereas if nothing happens, it's only going to worsen. And so we're really excited that we're going to be able to have more beds, though, out on campus. That is a limitation we have right now. And so we have 2 crisis stabilization beds in Ames and 2 up in Mason City. But a lot of times we're full, or because that's a co-ed facility, you might have a girl bed available, but it's a referrals for male adolescent. So we're really excited for campus to be able to have more beds and more ability to serve. And with that,
Well done, Andrea and Matthew. Good job, you guys. We've got 10 minutes for any questions. Here's how you can access services. We've got a great website, but then we also, I think Kara might have done this, or somebody, 2334 YSS. 232 for YSS. So really easy. We've got folks that answer phones and schedule appointments and answer questions. So did you learn anything? Go ahead.
So my question is, you mentioned that your treatment centers are separated by gender. With the increasing number of transgender children, how are you handling that situation?
Oh, microphone, yeah. Would be good. Yeah, great question. Thanks for asking. As they come in, we look at each situation and we want to partner with them in what they're going through and what they're experiencing. And so, we'll definitely, we work with that population for sure. And so finding out where they're most comfortable and making sure then we actually spend a lot of time with our clients. We work with Access and we work with other partners, and we want to make sure that even our current clientele, that they are very welcoming of different lifestyles. And so I think we do a pretty good job with that, even our staff for sure, but even our clientele. And so we have several different lifestyles at any given time in our facilities that are there at any given time. And so I think we've seen a pretty good handling, client to client even, of those situations.
It's a great question. And we looked at the data when we decided to do gender-based. For a long time, it was really like that just was the smart way to do it. And then you start to have these questions about gender and where kids fit. And we still are leaning into the data that says it's better to separate genders because but boys are about the same. Girls do better when they're with girls and they're not distracted by boys. Not that boys aren't distracted by girls, because I went to treatment. It was co-ed myself. So.
But I would say we've talked about, if the individual, we go by how they identify. And so then we figure out what's going to be the most effective for them. But we want to honor where they're at.
Perfect. Thank you.
What other questions? Or what's something you learned that you're surprised by? Oh, question.
Yeah. What transportation options do you help with transportation for families that are unable to get their kids there, or what? How do you?
Yeah, the questions about transportation, accessibility of services. Do we help?
Yes, absolutely. Yeah, we've driven up to Sioux City, what's it, Sioux City? We've driven everywhere. We help with gas money, so we get gas cards. I know Juvenile Court Services and HHS also provide some funds for that too, but we never want transportation to be a limitation, especially with visits and passes and that family interaction, because we believe in that so much. We do put a lot of importance into that area. So, a good question.
So it's one thing to get the kid to the program. It's another thing to get the family there, right? And so we have a family weekend called Strengthening Families, an evidence-based program actually developed at Iowa State. And when families come in for the weekend, we pay for their mileage and actually put them up in a hotel and pay for that.
And I would just say in our outpatient, we have the Cyride little bus tokens too. That's one of the things that we always have on our holiday wish list to get more donated to be able to give out to families as well.
that'd be one way you could engage. You might be thinking like, gosh, how could I help? When somebody asks that, we always say three things: champion, invite, and invest. So be a champion for YSS. You might hear about us in the community, or maybe you hear about a need that exists and you're like, hey, I think YSS could help with that. Invite. You might know other people that you work with, colleagues that you wished would have been here because, gosh, we said something that could be really applicable, and Kara or myself or Andrea or Matthew would be willing to have a separate visit or meeting with them to share more about our services. So invite other people to come alongside, and then invest. And we always ask for three things: time, talent, and treasure, right? So you're giving us your time right now. You all have great talent such that you could volunteer to be a mentor, or we employ nurses. We don't have a psychiatrist yet, but lots of opportunity to use your talent and treasure. And the one potential opportunity right now, Andre just mentioned it, is the holiday giving program. So we've got trees around the community. You can go to our website, you can adopt a family and support them. So hopefully there wasn't like some non-solicitation that I signed. So it's your choice. You make a decision about where you allocate your resources, but lots of ways to get engaged.
I saw Norma. Yeah.
Yeah, do you accept out of state, or is this mostly for everybody that's coming from Iowa?
That's a great question. It's do we accept people from out of state? I think we've built something that will attract people from out of state. On occasion, we have people come from out of state currently, and so we do the one-off contracts, whatever it's called from an insurance standpoint. Our focus is Iowa kids. This was built with investments from Iowa donors and a lot of public funds. I would imagine over time, assuming there's availability, we'll take some kids from out of state, but our focus is going to be Iowa and Iowa kids.
And we've served out-of-state kids before, not many, but there's just extra barriers, especially with the adolescents that are in school. Your Ames school, it's a Department of Ed, Iowa school district, something out of state, so there's just little nuances that become some barriers that you have to work through. But we have served some out of state, and yeah, I'm sure we will continue to have a handful through the years.
What else? 3.5 minutes.
Just kind of on that one, so specifically for the adult beds, the 18 to 24, with a city like Ames, where you have university students for the established residency isn't necessarily in Ames, is that one of those handful of situations you handle, or is that?
No, it's all going to come down to insurance. So there's got to be a payer. The great thing about Iowa is we're not quite an expansion state as it relates to Medicaid, but almost. And so currently, any young person that comes to us, we're able to get them on Medicaid pretty quickly. We'll do that same thing for young adults as well. And if they happen to have insurance from their parents' plan and it's out of state, I'm confident that we'll be staffed up to be able to accommodate. A lot of times those, not that it's all about the dollars, but right, a lot of times those one-off contracts actually sometimes pay more because they're not necessarily in network, and so they want to be sure that the kid that's insured gets the treatment that they need.
And I will just say, we're focused a lot on Ames, but that emerging adult, young adult, whatever we're calling that 18 to 24 age kind of group, we are looking at having our residential program in Mason City. So we have a campus up there that we'll have a residential program up there sometime this winter, and we'll be able to pilot it down there then before we start also serving that age group out on Ember. But we're really excited for that. We know that a lot of times that 18 to 24-year-old, no offense if some of you are that young, still sometimes will function like an adolescent. Brain development is not done. And yet, because of they're over 18, we really can't serve in an adolescent program. So your adult providers out there are saying, we don't want them because they just don't fit with our 30, 40, 50-year-old clients. And so we really look at this as an opportunity to better serve this kind of gap in services that we have in Iowa. So we're really going to be kind of first in providing a very specific residential treatment to that age group.
I would just say for the people who are online, because we do have an online attendance for physicians and providers, the one-page flyer, we're going to make sure this gets to the physician lounge today. We can take some to the behavioral health outpatient clinic. We're also going to email it to all active and community-based staff members, so you guys will all have access to it in your emails as well.
So just for those that might be online, we've got a one-pager that'll get sent out and distributed across the organization. We sure appreciate that. Kara, anything that we missed that you feel like we should have touched on? Well, hey, just want to thank you all for your time and your commitment. I think the connections to Mary Greeley and McFarland run deep. We have to be collaborative in this community, and I think we are better because of it. So we want to do everything we can to help you guys, meet your specific objectives, and grateful for the partnership. Thank you guys for your time.